Welcome to Be Time, everybody. I'm Beth Bierbauer, healthcare executive, author, and host of this podcast. Be Time is the podcast for individuals who want to invest in themselves and their careers through continuous learning. And each week on Be Time, I have the privilege of interviewing a seasoned executive, company founder, or other industry expert, and we talk about a variety of business topics. So whether you're with a large company or small, inside the industry or out, Be Time has something for you to help you stay on top of your game. So let's get started. Today's guest really doesn't need any introduction, but I'll share a little bit of his history with you anyways. I'm excited to say that Glen Tullman is with us today. Glen is the co-founder of 7 Mile Ventures, as well as a new venture called Transcarent. Now, prior to starting this new venture, Glen was a founder of Livongo, which is a chronic condition management company, and it made big news last year when it announced its merger with Teladoc for $18.5 billion. Prior to Livongo, Glen was also CEO of Allscripts, the medical records company, for 14 years. Glen is a strategic thinker. He has a good view of the system, and I'm excited for him to share his perspective of where healthcare is going, and to also tell us a little bit about his new venture as well. So please join me in welcoming Glen Tullman to the Be Time podcast. Glen, welcome to Be Time.
Thank you very much. It's great to be with you.
We are very glad to have you. So Glen, let's just jump in because I'd really like to get your perspective on a few things. You know, you've spent a lot of time in the industry, you've done technology, condition management, but you have a really unique perspective. And recently you wrote an article that basically said the collapse of Haven was a wake-up call. Why don't you explain to our audience what you meant by that and what you're seeing in the industry and what's lacking?
Well, big question. I think that Haven, let's start and talk a little bit about the history of Haven. So Haven was created because 3 of the largest, smartest employers in the US, maybe in the world, Amazon, JP Morgan Chase, and Berkshire Hathaway came together. And their CEOs said that there is no longer alignment between payers, PBMs, health systems on one side, and on the other side, large self-insured employers. Basically, what they concluded is the more money they spend, the more money that payers, PBMs, and large health systems make. So there would never be a case where they would legitimately actually try to reduce the cost of healthcare. So consequently, they said they were so frustrated, they said, we're going to start an entity. They called that entity Haven. And so when you think about that, imagine any business you were in where your 3 largest, smartest customers said you're no longer aligned with them, and they're so unhappy, they're going to try to start their own competitive business. That's what Haven was. And so that should have been a wake-up call to the industry to basically say, we have to figure out how to better align with our major customers. Now, when Haven happened, I was the CEO of Livongo, and my phone started to ring off the hook. And people were calling our largest customers, our largest clients, and those were large self-insured employers. And they said, if the 3 of them are doing this, my board wants to know what we're doing. And they tried to encourage us at Livongo to go into a broader focus on healthcare quality and costs. At the time, we were so focused on chronic condition management and providing a solution that we declined to do that. But that's why it was a wake-up call, because fundamentally, when your largest customers tell you anything, you should listen. And when they tell you you're not getting the job done, you should really listen and you should change. Instead, when Haven stopped operations, many of those exact same providers actually celebrated and said, see, we told you healthcare was so complex, so confusing, and so costly that nobody on the outside can fix it. I think that was, as we're seeing, exactly the wrong conclusion. And I think we're in for a big change in healthcare.
And we'll talk a little bit about your new venture in a minute. But when you think about business models that might have an opportunity to really change the game? What do they look like? What do they bring to the table?
I think the new business models will bring two qualities that we've seen in every other industry, particularly those whose business models have changed due to the internet. First and foremost, there's a focus not on product, not on solutions, but on experience. If you think about the iPhone wasn't just another new phone. They didn't advertise and say, we're better than the last phone you had. If you remember their ad campaign, they said, we're different. We're a completely different animal than what you've had in the past. And everything about that experience, and it was an experience, was different. From when you received the box, you looked at the box and you said, this is a beautiful box. And you opened it up and you said, this is a beautiful, almost a piece of art. You didn't say it was a phone. And then if you look at today, people under the age of 35, they're using their phone only 18% of the time for phone calls. 82% of the time, they're doing other things. They're buying music, they're taking pictures, they're using all kinds of apps from the App Store. So this was a different experience. And if you think about Transcarent, what do we start off with? We're creating a new and different experience of health and care. And so first, it's experience. Second, it's alignment. And Apple has always taken the position that their user, their member, all of us, the people, are first. And even on their recent positions on privacy, for God's sakes, they took on the US government saying, at all costs, we're going to protect the privacy and information of people using our phones. And that was as much marketing as any deep-seated belief. That was about them always being aligned. And so similarly, Transcarent is all about two parties. One, it's all of us. It's our mothers and fathers, our sons and daughters, our significant others. It's putting us first. And second, it's about the people who pay for care. And the people who pay for care are not payers. That's a misnomer. The people who really pay for care are all of us and our employers, and of course, the US government. Those are the only three payers in the world, because that's where the money comes from. So it's not about someone else. It's about how do we align with the people actually paying for things, and we have to advocate for them. So our model is always to put the true payers, the people, and the large self-insured employers first, to never make money, to never make a decision that would conflict with what's best for them first. And that's really the difference. So I think, the two big changes in the model today are, first and foremost, experience, and second, alignment. And, if you go to the major models that have upended industries, think about travel. It used to be you'd go to a travel agent. You remember that. I remember that. Not everybody listening probably does, but and that travel agent, you would ask them for information. You'd say, what are all the flights from Chicago to Los Angeles? But they wouldn't give you all the flights. They wouldn't include Southwest, for example. And so you had seen that Southwest had flights because they were advertising. And you'd say, I don't understand. Why didn't you include Southwest? They'd say, well, they don't pay me separately. You'd say, I'm sorry, I thought I was getting all the information, unbiased information. They'd say, no, you're only getting the information where I make money. Well, that didn't feel right. Second, you said, give me trusted guidance. And you'd want to know, what's the best flight for me? What's the best hotel? You kind of felt bad when you realized that they sent you to a hotel that had a special where if they sent 10 people that month, they'd get a free stay. That didn't feel very good either. That wasn't trusted guidance. It was biased guidance. It was what's best for them, not what's best for you. And last but not least, you said, can you get me in there? Because if you told me, gave me all the information, unbiased information, trusted guidance, then you want ease of access to the best value. And once again, in that case, it wasn't easy to do. Fast forward to Travelocity, All the information, unbiased, is there. Second, trusted guidance. You determine what your variables are. If you want lowest cost, you type in sort by lowest cost. If you want a connection, you type in connection. Anything you want, you're in charge. And last but not least, you book it, whether it's the middle of the night, whether you're at home, at work, wherever you are. So that experience is something people love. It was so good that eventually travel agents started using Travelocity because it was better information than they could get on their own systems, because their own systems came from airlines who were also biased. So we're going to get a much more consumer-directed future, and it's not consumer-focused. But if we say consumer-focused, that means, oh, I'm going to do you a favor. I'm going to finally focus on you. No, it's consumer-directed. My job is to give you all the information. You're in charge. And if you look at Amazon, not only do they give you all the information, they even give you the information of competitors to their own products. And you get to choose what you want to buy on their system. They've made it so easy to do. And they've actually even made it so easy to return. It's astounding. No questions asked, all about putting you first. And that's what the new models are about.
So let's dive a little bit deeper then into Transcarent and exactly how are you delivering on that unbiased information, that access to high quality care, and that trusted guidance. What does that look like?
First of all, great description, so I don't have to say it again. So what we're doing is we've designed the system to actually provide all of the information, whether or not it's beneficial. So we don't limit that by a narrow network. In today's world, you could literally, on your way to the hospital, let's say you're taking your son or daughter to the hospital, you could walk by an ambulatory surgery center that is half the cost, twice as good from a quality standpoint, and half the infection rate. And you would have never even been told about that by your current payer because they weren't on the network. That's just not right. I mean, think about that. Think about how that would feel if you knew you weren't taking your parents to the best place you could take them and that it was actually lower cost simply because somebody else made a business deal that excluded them. And so first, we're opening that up. It's not a closed system, it's an open system where you have a broad range of choices. Now, that's kind of tough because we go to people and they're used to saying, am I going to be preferred? Am I going to be the only one listed? No, you're not. But if you're the best, you'll be listed first. How do we determine who's best? We don't accept any payments or anything. We go out, we pull all of the different information sources. We provide that information. Again, we let you decide and we'll share it with people. We'll say, here's the information from 2 or 3 different sources. Because today there's actually a lot of sources, some very good ones. A great company called Cedargate, we like a lot. I won't list all the companies, but great companies out there doing really high quality work on sorting out everything from the best facilities to the best physicians in those facilities to the best experience. So we're aggregating all that information, but it's not enough to aggregate it. You have to make it usable. So then we're actually providing people who will discuss that with you. What's most important for you? I mean, you've been around the industry long enough to know that you might have a drug that's most important, but if the copay is so high that you can't buy it, well, then we've wasted a lot of time. So we have to provide people with the full picture. And by the way, at Transcarent, we're eliminating billing. In most cases, we're eliminating copays. Because think about what a copay is. If I say, take this medication so you can stay healthier. And then I say, and by the way, every time you go to pick it up, I'm going to charge you $20, $30, $50. Well, some people say, look, I have to make a trade-off. Do I want to eat today or do I want to pay $50? And they choose not to take the medication we know will keep them healthier, keep them out of the hospital. So what happens? They get worse. They miss work. They may end up in the hospital. And we're going to pay either way. That's the thing. Employers have figured out that if they don't take care of their people, either way, they're going to pay. So if they take good care of their people, if they send them to the right high quality facilities, then the cost will take care of itself. You focused on cost first, it's not going to work. And we all know that intuitively. That's the way we manage the rest of our life. It's just that hasn't, up until now, worked in healthcare. And we're seeing it. And by the way, turn on the TV. How many ads do you see if you turn on the TV for different pharmacy solutions? We know whole industries have been built now, PillPack and GoodRx, and name after name of people who said we can do a better job than the industry has done in the last 25 years. We can do a better job. And they're winning because who's making that decision? Consumers are. So look at the valuations of what was paid for PillPack and the valuation of GoodRx and the like. These are multi-billion-dollar companies built because people just lost confidence in the experience. And that should be a wake-up call to everybody involved, in that case, to PBMs and to payers.
Well, especially pharmacy is such a great example because people are typically paying against the retail amount and the health plan is receiving the rebate. Now, obviously coming from the payer side, they do actually factor that into the premiums as a means to keep premiums low. But if you are that individual, you're facing that retail amount, of course you're going to shop around with a GoodRx because literally you can save 50 hundreds of dollars out of your pocket. And I think that transparency is what people really struggle with. So I really appreciate what you're saying.
I do have, so let me give you one example, because I've often heard people say, well, we take the rebates into account. But think about what's really happening. You have a sick person standing there needing a cure or needing, help, alleviation for a chronic condition. And what you're saying is we're going to make it harder for them to feel better. So theoretically, we can help healthy people. That doesn't really make a lot of sense. In addition, we have at least one PBM that I'm aware of that when you walk up, if you say, I have no coverage, they say this generic med is $4. But if you say, I'm covered, they say, okay, it's the higher of your copay or cost. So they might say, okay, it's $25. Now, how in the world could that make sense? And who are they trying to help? If I can walk up and say, no, I don't use your service, and I get a better deal than saying, if I'm covered by XYZ PBM. I mean, that is absolutely ridiculous behavior. And frankly, it shouldn't even be allowed because they are gouging. And what they're saying is, oh, well, we're using that for what? I mean, we know these companies make a lot of profit. I'm not against profit, but don't tell me that you're taking all that money and reducing the cost of claims, because the problem is, if you're a large self-insurer, you haven't seen claims costs go down. You haven't seen the experience improve, and you haven't seen it become less confusing and complex. In fact, ask anybody, say, have you received a bill that printed in big, bold letters says, this is not a bill? Now think about what happened there. Somebody had to say, this is really confusing people. And so instead of correcting it, we're going to print on there, don't think this is what it looks like. Why wouldn't you just solve the problem? It's kind of like if we go back to the old electronic health record world, we've developed a system, the leading system now, Epic, is so complicated that instead of fixing the software, we said, hire somebody to sit between the physician who's supposed to use it. It's so complicated, she can't figure it out. So she's going to talk to somebody else who will enter it. Imagine if any other software you can think of worked that way. Imagine if Google worked that way. I want to use Google. Let me call somebody to come to my house because that software is so complex. I want to use Airbnb. I want to use Netflix. We figured out intuitive, simple interfaces in every other industry. And somehow we convinced that $1 billion system needs a scribe. We've created a whole new name. again, it could only happen in U.S. healthcare. And that's what we have to fix.
So, Glenn, when you walk in and talk to an employer today, they have their health plan, and then most of them have added on all these additional point solutions, specifically because they don't feel like they're getting the level of services that they need from their health plans. You walk into that employer, what do you say to them? Do you say, start from scratch? You don't need any of this? How does that look?
Well, we have, we've seen recently the average employer. I think the Wall Street Journal just did an article about this a week or two ago, and they said the average employer is drowning in separate siloed solutions. And I think they have on average 14. Now, if you're a really large employer, maybe you have a team to manage those. But the middle market, it's simply not available. And again, it's more confusing, more complex, and more costly. And what we've seen is over the last 25 years, there was a promise made to us, and that was that payers and PBMs would make healthcare less confusing, less complex, and less costly. And it didn't happen. And then we had 10 years ago, innovators from Silicon Valley, like Livongo and others, came along and said, hey, we'll help. And so they added their solutions, but adding more solutions didn't help. In fact, at Livongo, we had people who regularly said they were people with type 2 diabetes, hypertension, and weight management, which sadly all kind of fit together, as you know. And they would have not 3 different coaches, they'd have 4 or 5 coaches, 2 or 3 doctors, multiple medications, multiple devices. And literally they'd throw their hands up and they'd say, enough, I can't manage it all. And they weren't talking about their diseases. They were talking about all the complexity we had added. So basically what we've said is go to one place, have one care guide, talk to a physician anytime you want, and you can talk to her within 60 seconds over chat. If you want to, you can ask for video, she'll flip it to video. If she needs to see a rash or something, she can ask your permission, because remember, you're in charge, to flip it to video. So again, it's one place to manage all of your care needs, available 24/7, available over an app, but available with a person, and not press 1, press 7, press 3. It's an actual person who will pick up the phone. Why? Because we think it's really important. You're talking about your health. We want to have people available to solve your problem at that moment. So we're meeting you where you are. You might be at home. We're not going to ask you come in the middle of the day, interrupt your work day, and the like. Let me give you just one example. We have a great company we're working with called Zerigo. And if you have psoriasis, traditionally the solution was a topical medication that didn't generally work. And the second step therapy is light therapy. And so we would tell people we'll go 2 to 3 times a week to your dermatologist for 20-minute appointments for 12 weeks. What job can allow you to leave 3 times a week in the middle of the day for 12 weeks? So people didn't do it. They jumped immediately to biologics. Biologics like Humira, most people don't realize this, cost between $35,000 and $40,000 per person. And they have a lot of side effects. So this company developed a remote connected device you can use anywhere that only turns on and provides light therapy when you need it, when you have an appointment, so you can't overuse it. And it's getting so sophisticated that in future versions, it will only apply light therapy to damaged skin. And then we'll send back the results of whether it's improving to your dermatologist. You do it at home, you're in charge, and it is about 1/10 of the cost of the current solution with no side effects. Simply better healthcare. But who's going to tell you about that? Not the people making money, not the people asking you to go to their offices. So in every case, we know as an example that about 30% of the care provided in hospitals for things like infusions could be done at home, more convenient, less dangerous, no secondary infections and the like, and less costly. But the hospital isn't going to say you're paying too much at the hospital. You should have this done at home. Now, most innovative hospitals, they're wonderful. They're doing just that. They're going into that business and saying, we have to do what's best for our patients, for the people. And so we'll provide it at home. We can do that at a lower cost with good reimbursement. But most hospitals don't say a word about that. So we have to be the advocate for all of us and for the people paying for that treatment.
It sounds like that you already have, but will be identifying new capabilities that can address this issue of ensuring that you're getting the right type of care, but also that convenience, because that convenience really matters. And I even hate to use the word convenience, because every time you go out and you go to a doctor's office, especially if you're elderly, it can cause problems, right? And so the fact that you're able to introduce something into my routine as the consumer makes me more likely to use it, right? To build a habit around that as needed. So again, I hate to use the word convenience, but it seems like it's the right thing to do. So you'll be building out some capabilities by looking at these innovative companies, I assume.
Yes, we will. And again, you shouldn't feel bad about using the word convenience. Our entire life, we do things that are best for us, and that is convenience. So it's why more and more people are ordering services at home. It's why we go to certain places and not others. We're constantly making decisions about what's best for us. And what's best for us is some combination of convenience, quality, and cost. And in the rest of our life, we make that decision all the time. And in healthcare, that had been taken away from us. Today, healthcare happens to us. And I watched this with my mother before she passed away. She had cancer, and she was told, here's what you're going to do. For the next year, you'll be in a hospital for 12 months. You'll get chemo and everything else. And she was smart enough to say, wait, stop. That's not how I want to spend the next year. I'm going to spend it with my grandchildren. I'm going to spend it traveling. And I went and I talked to the doctor and I said, can she beat this? And the doctor said, no. And she had lived a great life. She had 6 kids. And she spent the last year, she had an incredible last year. And there was almost no cost versus millions of dollars, and she would have been miserable. And she made the best decision. But the assumption was, oh, you're going to be in the hospital, you're going to be connected up, wired up. You will spend your last year in a hospital bed in kind of a place that's not the most hospitable, versus enjoying your last year. Now, that's not the choice everybody will make, but it's her choice. Even my sisters didn't agree that she was making the right choice. And I had to say, look, I have no idea whether she is or isn't. All I can tell you is it's her life, her choice. And it turned out that was the best choice for her. Everybody agreed after the fact, and it was amazing. But we have to get back to giving people control of their health care, putting them in charge, doing what's best for them. And by the way, we've seen the innovation in pharmacy. We've now seen you can get your meds at home, delivered in easy to use packaging and the like. I mean, PillPack, their packaging, unbelievable how easy they've made it. They print the date on there. So if you miss one, I was on a statin for a while and got their meds. I wanted to try it. I got their meds and it has the date printed. And then all of a sudden I came back from a business trip. I said, oh my, I've missed one of these. So I knew because they had made it so easy. Even opening the package, so easy. Everything about that was easy. Now we're going to see that same innovation in the lab business, because today you go out and you get tested and sometimes you have to wait a week or more. We've seen one of the few good things about coronavirus, if there's anything good about this terrible pandemic we faced, is we've seen how good we can be when we're pressed. Our scientists, amazing science, multiple vaccines that they've been able to create in record time. That's amazing. That wouldn't have happened. And we've seen in healthcare innovation, and we've seen in retail innovation where older people who couldn't get out, and you mentioned it, transportation is one of the leading reasons why people, especially elderly people, don't get care. And now we've seen we can get food at home, we can get care at home. Great companies like Dispatch Health are delivering care at home to people so they don't have to go to the hospital, and they're doing it more cost effectively. And by the way, we're not investors in Dispatch, but it's just a great company. What can I say? So we're seeing that kind of innovation. And even in telehealth, you remember telehealth pre-pandemic was 3 to 5%. During the pandemic, when we couldn't go to the doctor or the hospital, it shot up in some cases to 100%. And now it's settling in probably 30 to 50%. But that's 10x what it was in 6 months, 9 months. If I would have told you, particularly in your prior roles, that we could make a change to do a 10x improvement in 6 months, you would have said, Glenn, you're crazy. Maybe you say that anyway, but you would have said that. And yet we saw it happen. So now the best health systems, the best health plans and payers, the best PBMs are starting to say, we can drive change. But it's not about adding more separate solutions. It's about rethinking the care experience. And so when we add solutions, we don't just say, here's another solution added on. We want to make sure it's a complete flow. When you're checking in our symptom checker and you say, I'm looking for back pain, then what pops up without re-entering, without dialing in is, here's your various options. You can talk to a doctor about it. You can get these medications. Here's all your solutions, and it's all seamless. That's what people want. So I think that's a big part of the future.
So, Glenn, this has been really, really helpful. I know you're a curious learner, and we like to ask our guests on the show what books have inspired them or they're currently reading, and what is on your podcast playlist.
So Michael Lewis's new book came out about the pandemic. That is, and it's called the Premonition. That is an amazing book. It's Michael Lewis is a wonderful storyteller, and he talks about kind of all the background of what led up to this, and in fact gives some credit to some interesting folks. George Bush, on vacation, read about the great flu epidemic, came back and said, "What is our plan?" And we had no plan. And he was authorized $7 billion to create a plan. Unfortunately, the last administration ignored that and a lot of other things. And but that was, lest we say Republicans and Democrats, it's not about that. It's about health and medicine. And so, he gets a lot of credit for realizing what could happen, for putting into place a number of those actions. And we chose not to follow them for the worst political reasons. And it cost a lot of lives. But it's a wonderful retelling of the history of what happened. So that's a really terrific book. That's the book I just finished. But I try to listen to, I have to admit, I'm not reading a lot of books, but I'm listening to them on tape while I run or Peloton. And I try to do that at least 1 to 2 books a week. There's a lot of great stuff out there. So there's another great book called Post-Corona by Scott Galloway, and unbelievably good book. And there's a section in there on healthcare, what has to change, and on education, what has to change. And that book, a very easy read. Every executive should read that book because he is spot on about the changes that are coming, that were overdue, and that will be driven. And some of his predictions, which were made when he wrote the book, of course, have already started to come true. So that's another great book I'd recommend.
That's great. So, Glenn, thank you so much for sharing your perspective with us today. I know that I've learned a lot. It's always good to hear your view as to where things are going. And we will check back with you within the year to see how well Transcarent is doing. And we have no doubt it'll do well.
Well, thank you very much. It's an honor to be on here. You've interviewed some great people, and I'm happy to have been. I'm not sure how I got on the list, but happy to be added. So thank you, and great to talk with you again.
All right. Well, you're welcome. And for our listeners, that's it for another episode of Be Time. We will be back in a week. Thanks.